We're really excited to have this panel with us. And I think what I'd like to do is you could start just going down the line with sort of what was your take-home message from the movie?
Well, to me, it would be early detection. You have to go for your preventative services. That's how I found it. I was engaged at 17, married at 19, at 25. I was having my pap smears every year, like the stories you've heard. And then one year they tell me it's abnormal. I come back, they do biopsies, I'm told I have cancer. I didn't, at that time, in 1985, I was 25, I did not know what HPV was. I didn't know anything about this. So to me, is everyone has to have your preventative services.
I'm a gynecologic oncologist, so I've done more training in terms of cancer treatment, particularly in patients with cervical cancer. I think the take-home message is this is a preventable cancer. We have something at our fingertips to actually prevent cancer. And I don't think people understand that. This is not just preventing an infection, but this is something that leads to cancer, not just cervical cancer, but head and neck cancers, penile cancers, anal cancers. I mean, we have something that can prevent this. And so I think the take-home message is people need to know. Anytime I see a patient with cervical cancer, I address the patient, but then I talk to the daughter, I talk to the mother, I talk to the grandmother, I talk to everybody. I say, do you have any kids? Do you have any grandkids? Do you have anybody between the ages of 9 and 26? Have they received the vaccine? So I immediately start just going into trying to prevent, essentially, women from seeing me, with pre-cancers, which can be devastating, and then also the cancer diagnosis.
And as a pediatrician, I would just reinforce that comment that if you have neighbors with children, if you have grandchildren, it's really important to just spread the message about how important this vaccine is and how effective it is. And I know this movie focused on cervical cancer, but it also prevents oropharyngeal cancer, which is outpacing the rate of cervical cancer because we have really amazing screening for cervical cancer, but there is no screening for the back of the throat cancer. So we can prevent that as well. So family physicians should be recommending it to their patients, pediatricians should be recommending it, and if they haven't, you should make sure your children are receiving the vaccine.
Well, two things I'd like to say. The first one is, again, to emphasize that the focus initially has been on cervical cancer, but as you just heard, and the movie also mentioned that there are other cancers related to the same HPV viruses. And those other cancers cannot be screened for. And the only thing you can do to prevent those cancers is vaccination. Even though we have the pap smear screening, and people originally, when the vaccine came about, they said, well, what do we need a vaccine? The pap smear works very well. Of course, it works well if you do it. But also and this film illustrates that, there is a vulnerable portion of the population, particularly young women, in whom, for some of them, the cancer develops extremely quickly. And the pap smear is done at intervals that could miss those lesions coming up. So that's why the vaccine brings even something important for cervical cancer. The second thing I'd like to say is that I really enjoyed this movie. I like it because it's factually proper, but also it gives emotion. And I think emotion is very important because, as you are very familiar, there are a movement against vaccines, and sometimes it focuses on some vaccines but not others, or it even decries the HPV vaccine. And the people who are arguing against vaccines, they give a veneer of sciences and facts when in fact they are really wrong, but also what makes them convincing is emotion. And I think it's good to be able to fight back emotion with emotion. And it's a dimension that was, I think, missing, and that the film does very well.
And they did a great job, I think, in the movie, just talking about how ubiquitous it is. It's everywhere. And it's not necessarily just with sexual contact as in penetration, but just skin-to-skin contact. And so majority of people are exposed, 90% of people clear the virus. And what we're worried about are those persistent infections, the persistent HPV infections that eventually over time can lead to causes in changes in the cervix, which then over time can lead to cancer. And that's where the interventions of Pap test, HPV DNA testing, colposcopy, LEEP procedures where we resect a portion of the cervix, are all sort of interventions to try and stop that progression. And then, of course, if a patient then develops cancer, we're talking about far more invasive procedures. But even those other interventions, like LEEP procedures where we remove a portion of the cervix, can affect fertility. So we're talking about precancers being treated to prevent it from developing into a cancer, but those also have long-term consequences. So this is a virus that majority of people can clear. We haven't figured out who those women are or men that don't clear the virus and have these persistent infections. There are no labels associated with those people. We don't know what it is about the immune system that allows those persistent infections. And so that's why I think it's key to be tested. The recommendation is in terms of screening for Pap test is after the age of 21 is the recommendation. And then after the age of 30, you can incorporate co-testing, so Pap test with HPV DNA testing. The reason we don't do it prior to the age of 30 is because women and men are affected with these the HPV infections, but they clear it because majority of people are clearing. So we don't think it actually has clinical significance to then lead to these invasive procedures. And so it's a series of Pap tests. It's a series of severe abnormalities that then lead to the interventions, not necessarily the HPV DNA test result. And then after the age of 30, we do co-testing. Depending upon what the Pap test shows and the HPV DNA testing, that then leads to looking at the cervix with a colposcopy and then potentially other interventions.
So the example of the Pap smear done on the cervix has been copied and applied to the anal canal, where the same technique is used. You look for the lesions that a gynecologist would see on the cervix, and also you do some exactly a Pap smear. You can even look for the presence of HPV. This approach has not been validated yet, and we don't know if it's really going to be effective. It might detect some cancers, but what is the cost and what is the impact?
And so that's what the HPV DNA testing is looking for. Just HR-HPV means high risk HPV, and looks at all those viral types. The HPV vaccine that covers 9 viral types are the most common and protects more than 99% of HPV, high-risk HPV infections. And so with that vaccine, it would cover that. In the video, they were talking about 16 and 18, which I think causes about 70% of the infection. But now we have a vaccine that covers more and includes all, several other high-risk viral types.
The question is, why is the vaccine not yet mandated for school? And it goes back a little bit in time because the vaccine was mandated in Texas very early on after it became available, which was quite unusual. Usually it takes a few years for a vaccine to be recommended before it's required for school. So it is required in Rhode Island, Washington, D.C., and Virginia, and they do have higher rates there. And I think probably in the next year or two it will be required in New York City. The rates tend to be higher before it becomes required. So it needs to be accepted by all physicians, family physicians, pediatricians need to be recommending it and buying into it, I think, as a first step. And then the next step, I think, would be a requirement. But there's been a lot of pushback in various settings. I would just say, so destigmatizing the vaccine, I think, is really important. So standardizing it so that you're offering it to every 11-year-old. And some practices are offering it at 9. And the feeling for offering it at 9 is then nobody's really thinking about sex at all. And even at 11, we're not thinking about it. We're giving it long before we're thinking about the patient being sexually active. So just making it the norm, just like we do with Tdap, a meningococcal vaccine. We don't go into a lot of depth talking about how you get tetanus or how you get meningitis. So we just really want to give everybody the vaccine and not make it seem different than anything else. And we don't have to have a long discussion about it. And then we'll have a higher vaccination rate.